I'm your host, Peter Komendowski, and welcome to Surviving Bad, where we explore Iowa's stories of survival, hope, and inspiration. Alcohol and children are a bad combination. Children have grown up in the face of risky behavior since the dawn of civilization. They begin life innocently under our protection as parents, caregivers, and community leaders. But today, we're going to talk about one problem, youth alcohol use and abuse. It just does not seem to go away, and for children, it can lead to tough times as they grow into adulthood. The good news is that we're getting better at getting to the root causes of the issue, and community leaders are working hard on solutions. Two of those leaders, substance use prevention expert Laurel Muting and Iowa Senator Mark Costello, are here to help share some insights on the issues and what you can do to help. Welcome to the show.
Thank you.
Laurel, start us off, introduce yourself, and we'll get started.
Okay, thanks for having me today. I really appreciate being able to share some information here on the show. My name's Laurel Muting. I'm the Prevention Director at Heartland Family Service, and I've been in prevention with Heartland Family Service in Council Bluffs, and we serve Harrison Mills and Pottawatomie County in Iowa, and I've been there for 15 years. I've been doing prevention for about 18 years. And so it's just an honor for me to be able to share information, and I really am passionate about sharing prevention information with anybody who will listen. And so thank you for having me on today. I appreciate it.
Thank you for joining me. Pretty well respected as an expert in the field. And Mark?
Good morning. I'm Senator Mark Costello. I'm a state senator. I represent the very south corner of Iowa, Mills, Montgomery, Fremont, Page, Taylor, and Ringgold counties. I've been in the Senate for 6 years and just got reelected this last election. And one of my biggest committees that I am the co-chair of the Health and Human Services Budget Subcommittee. And we fund a lot of the health programs, and the substance abuse is a very big part of that budget, and it's a real problem that I deal with every year.
Laurel, while we're on that topic of budget, we've often looked in the prevention arena that there's a tremendous dynamic between investment in prevention and that return on investment. So many people think prevention is an expense, but the real expense are the issues surrounding things like alcohol abuse. Now, let's start out with what is the primary issue about youth and alcohol in Iowa?
Well, for a while now, we've kind of seen some of those rates go down. Binge drinking, underage drinking go down in Iowa, which is good news. It's great news. But now with COVID and kind of what's happening with this pandemic, we're starting to see those numbers go back up. And it's really alarming. It's not even, I know, this show, we're focusing on youth, but we are seeing huge increases in adult alcohol use through this pandemic as well. People are drinking their way through this pandemic, and it's of real concern to us. Not only are we seeing use disorders, so alcohol use disorders increase in youth and adults, but we're also seeing relapse happening for people as well. And so I think alcohol is something that we're always going to have to deal with, obviously, because it's legal and it's here for the long term, I think. But I think sometimes there's maybe some parental fatigue that goes with talking about underage drinking and youth alcohol, because so often I hear parents say, well, I did it when I was a kid and I turned out fine. And, then I very quickly point out to them, just because I made high-risk choices when I was a kid and I turned out fine, does that guarantee that my kids are going to turn out fine if they make high-risk choices just because I did? And the answer to that is obviously no. And so I think as parents, we need to be doing some more critical thinking about, underage drinking and if it really is a big deal. And I think then that's hard for youth because they get a mixed message. They hear from, experts and prevention people and school folks that underage drinking is not okay and it's not something they should do. But then they go home and parents are like, well, I did it. At least you're at home. You're not driving. So I think there are some real mixed messages, not only from our communities, but from the industry as well. And that's a whole other.
Yeah, that's a good point, because, we've even had specialists say that, we look at the world today, a very young child, 4, 5, 6 years old, can open the refrigerator and the distinction between a beer or a soda pop or a juice is hardly noticeable to them. So it sort of normalizes their view. Now looking at the idea that we all would agree that it would be wonderful to prevent children from using alcohol. We know that if they don't use alcohol before the age of 18, their life outcomes are hugely better. But what's this dynamic, what we hear about, where you get like $7, $8, $9, $10 return on prevention investment? Because to me, that sounds like I'd love an investment like that.
Right. Yeah. And so, for every $1 spent in prevention, you get a $10 savings in return on that investment. Return from, kind of those social costs that we see that happen with addiction, whether that be hospitalizations, whether that be arrest rates, whether that be whatever lost productivity, whatever the case may be. And so we know prevention works. I think prevention is kind of a relatively new science. According to some, people think that that might not be a science, but really there's a lot of science behind it. We have evidence-based practices that we know work in certain situations, but it's also more than just about talking with kids about high-risk choices. It's environmental, looking at the environment that they live in, and not just in their house, but in the communities that they live in. What does that environment look like? And are they bombarded with advertising and access to alcohol all the time? And those are things that we can change as a community. So prevention is multifaceted.
Yeah. We'll take a short break, and I'd like to come back and then we talk to Mark and sort of get a feel after the break of what the climate's like on this potentially great investment called prevention. Stick with us. We'll see you after the break. You don't want to miss this.
There are everyday actions to help prevent the spread of respiratory diseases. Wash your hands. Avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze. Clean and disinfect frequently touched objects with household cleaning spray. For more information, visit cdc.gov/COVID-19. This message brought to you by the National Association of Broadcasters and this station.
Every second, 127 new devices connect to the internet. You can feel it happening. Our digital world expanding with every breath. We're entering a whole new era of connectivity, and Mediacom will be ready to power it with one of the nation's first 10G platforms. We'll be bringing you more speed, more capacity, more security, and the power to do more than you ever dreamed possible.
Welcome back to Surviving Bad. We're talking with Senator Mark Costello and Laurel Muting about children, alcohol abuse, and some potential to make things better in Iowa. Mark, when we went to the break, Laurel was talking about this investment concept on prevention. What's the feeling like on the Hill? Is there a sort of a momentum to say, hey, this is a good investment for Iowa?
Well, I believe there's certainly interest in that. And sometimes it's hard to say, okay, where does the money come back to us? You say, well, it's a great investment. We hear, with tobacco prevention and a lot of abuse prevention, illegal drug prevention. And we can see that societally, but we still have to have the money from the general fund to fund the investment. And so where do we get that money? So that's always a struggle. There's competing funds for different things that we need and treatment and just where we can reduce the treatment would be great if we could invest in things ahead of time. And I think it's hard sometimes to have a long view. We're sometimes a little short-sighted. It's like, well, we've got this budget problem right now. We've got to come up with money to do what we want to do right now. So that's kind of, we always try and look at that and see where we can best invest our money.
Well, I'll throw something at you, not being a farmer, but I know you are, and I really appreciate you taking time from being out getting your work done to join us today. But one of the analogies that we've used in dealing with people around the state is the fact that, we like to think that the number one crop in Iowa is our children. And if we take sort of that thought, that identity of a farmer that looks at a crop and says, if I see an invasive weed or I see a problem, I need to fix this. My livelihood, my future, and everything's dependent on it. Now, one advantage is that as you learn lessons, you get to harvest and then seed a new crop the next year and learn from those lessons. But we can't just throw away our children and start with new lessons. We're committed. We're sort of committed to this process of raising them. I've always felt that if Iowa, as much as it reveres agriculture, and justifiably so, put children in that same light, that maybe there would never be a question of doing what's right to make sure that the safety and the potential of that crop of children that we're raising to trust with the future of Iowa is at the highest order of responsibility. Shouldn't that at some point in time, maybe, you think we can change the way people think and maybe change your priorities about funding if we can get them to think that way?
Well, and I think too, if I can just add, I think it's hard. Sometimes I feel like, and I've been doing prevention for a long time, sometimes I feel like prevention is a hard sell. Number one, it's hard because I am too busy doing it to talk about it. So I don't have a lot of time in my day to talk about all the stuff that we're doing, because it would take a whole day to talk about all the stuff that we're doing. And so oftentimes I neglect that part of it because I'm off to the next school, or I'm off to the next meeting, or I'm off to the next, time I have at my computer to get something done. So I think we don't always talk about all the things that we're doing, number one, but number two, it's hard. Prevention outcomes are hard to measure because you don't know what you're preventing, right? That's the goal. And so we can measure how many people we served, we can measure how long we talked to people and how many students we saw in a year, but that's not a true outcome. That's really an output. And I understand that those things need to be measured and we need to have accountability for the money that we're spending. But I think it's really difficult with true prevention outcomes because you don't know what you're preventing until you've done it and it's been prevented, right? It's the same as getting an oil change in a car, right? We change our oil every 5,000 miles because we want to prevent problems. And you don't know what you're preventing when you do that, but you invest in it and do it anyway. And so same thing with preventative physical health care too, right? So every year we take our kids to the doctor for their well baby visit or their well kid visit. Again, because we're trying to prevent problems in the future. And so I think it's, instead of looking at it as outcomes, what am I funding and what am I getting out of this funding? If we looked at it in a different way, in a way that's acceptable for our cars and for our physical health care, then it might help us kind of understand what it is we're preventing.
Yeah, it's very hard to exist on having to prove what doesn't happen as being the primary purpose of your work. Great prevention means you're measuring things that didn't happen. But we do also know that, like you said, as prevention specialists, one thing we've learned from having guests on the show is that you are really busy. So you can't be at the Capitol all the time when legislators need education. And the people who have children who are suffering or loved ones they're caring for, they're dealing with substance use disorder, they don't have time to be at the Capitol, or they're wrapped up in dealing with what's important to them. On that note, Mark, what do you hear from your constituents when you're out there? Is this an issue that is relevant to a lot of people in Iowa, especially in your districts?
To be honest, I don't hear a lot of that. We do tend to talk about, the general decline of society and, and what the problems that we have in general. And we talk about the culture that we have out there that makes it acceptable for children to abuse alcohol or use alcohol. And that worries me a lot, the culture that they have within the schools, within their peers, and with their families. And so that's kind of one of the areas where I would really love to see the attitudes toward it be changed, and that it would be something that there's peer pressure not to drink rather than peer pressure to drink. So that's kind of the area I would see it mostly.
On that note, let's take a short break, and then knowing that that's also a priority for you, Lorella, when we come back, let's sort of hear your wish list, if we could, for what we would love to envision to happen throughout Iowa, and maybe where some legislative help might help promote that. We'll see you all after the break. You don't want to miss this.
While a lot is changing in our world, at Mediacom, our focus remains the same, making sure you have the fastest, most reliable connection possible. During this critical time, we know your needs are changing. You may be working or learning from home, relying on telemedicine, or finding new ways to keep everyone entertained. If you need more speed, call or go online, and Mediacom will double your speed immediately for as low as $10 more a month for 1 year. Right now, millions of people and billions of devices are connected to the internet. Homes, businesses, hospitals, schools. The security and reliability of these connections are more important than ever. That's why at Mediacom, we've built a network to protect them. A network that sees threats, fixes problems before they occur, and keeps you going with 99.99% network reliability.
Welcome back to Surviving Bad. I'm your host, Peter Komendowski, and we're talking with Laurel and Mark, about what you can do to protect your family and why it's so important for everyone to pitch in. Mark, you were talking about a really great power in terms of the influence of a family on this kind of behavior. Can you share your story with us?
Yeah, so as I grew up, my father always encouraged us not to drink at all. And the reason was one of his brothers and one of his uncles were alcoholics. And he said, you never know whether you'll become an alcoholic or not. And the best way to never have a problem is if you take that first drink. And so throughout my life, I've practiced that. I don't miss it because I've never experienced it. I don't think it's something that I desire at all. So that's what I'm teaching my children and raising my 5 children, that they will just never even think of that as something that, that makes me an adult if I drink it, or that makes me cooler or whatever. Just don't take it, because abstinence always works. And that's what I'm trying to teach my children. I think it's very effective. It was effective for me and all my siblings. And I really wish people would do that more.
Well, Laurel, what's sort of on your wish list around the state that you would like to see happen to help promote this sort of great climate of empowerment of not drinking, as opposed to the powers that be that push drinking as something?
Yeah, and that's a huge wish list. But I think alcohol is so normalized in our community and in our society. It's normalized that you have to do it to have a good time. And it's an expected adult activity, right? And so I think that would help our kids, number one, if it wasn't like that for adults, and if we weren't seeing alcohol as a kid at every single adult gathering that we have, or knowing that our parents are going out and making high risk choices. And I think, a lot of times people, when it comes to adults, people think, well, they're an adult, they can make their own choices. And that's absolutely true. But as a parent, I have to set a behavior standard for my kids. And so if my kids are seeing me make high risk choices all the time, but I'm telling them not to, or maybe I'm not even talking to them about it, they don't know anything else as a child other than what they see their parents and adults around them do. And so I think that's a huge wish list to get to be able to understand that alcohol use is associated with lots of problems that most people don't want to develop. No one wants to develop heart disease. No one wants to develop cancers related to alcohol use. No one wants to develop cirrhosis or get in a crash and kill people. But like I tell the kids that I work with, that's why our choices are so important, because I can't take them back. Once I've made high risk choices and I lose things that are important to me, I can't take it back. I can't go back and get out of the car and not crash and kill people, right? And so that's why our choices right now matter so much. And it's hard for kids to think that futuristically because they're about instant gratification, because that's how their brains are wired currently. And
well, what do you think we could do? Do you see some things that, you might have a wish list for Mark, like legislatively? Are there some ideas that the prevention community has that you wish could get some traction?
Well, and I think one of the biggest things right now that we've seen is all of the rollbacks on the regulations that we've had across the state and across the country on alcohol sales. to-go containers now, being okayed by our state. And, those things, again, send a message to youth, whether it's on purpose or not, right? They see that as a priority. And so I don't know, it's really, I feel like we've just undone decades worth of prevention research to prevent underage drinking and driving by some of the rollbacks that we've seen in some of the alcohol regulations. We need to make sure that to-go alcohol is being regulated, and we need to make sure that home delivery is being regulated. And we need to make sure that we're maintaining limits on hours and days of alcohol sales and outlet density, right? Where are all these alcohol outlets at? Are they within 1,000 feet of a school? Are they by a church? Are they by a treatment facility? And so I think those are kind of some environmental things that we can really think about how to prevent some of the problems that we're probably going to see in the future because of the rollback on these regulations due to COVID.
This is a lot of work you're putting on a table for Mark here. It's going to take a few sessions. But, there is something we've noticed. Mark, maybe I'll ask you about it, because they did roll back some stuff on carry-out alcohol. And we've had people in different communities going out and testing this law. And basically, not only does it seem unenforceable, that the retailers are generally ignoring it. So we have a law in the books that have now created a whole new access point for alcohol in vehicles and on street corners, with the intention that these things are supposed to be somehow safely sealed and labeled. Absolutely not what we're hearing. We've had numerous people go to restaurants, get carry-out orders. Some places don't even realize that's a law. In other words, simply say it's not enforceable. It's too expensive for us to entertain. So the spirit of the law was to make alcohol available, not to limit its access. So, sometimes there's a great idea to help business, but it could really it could really hurt kids. Is this a hard thing to resolve when you do great legislation and then all of a sudden it has all these unintended consequences?
Well, certainly it was very hard for those few of us that voted against that legislation to make an argument, because it was the businesses were hurting. It was like, you're not pro-business if you don't do this. And, not that I got people that were critical of me, but to get them to come over to my side was I didn't feel much help. I do think that you've got to, when this legislation comes, the opposition has to show up at the subcommittee meetings where there's an opportunity for them to speak, because then it would give us a little bit more help in arguing against this and say, here's the damage that may be done. You don't necessarily know until it happens, but sometimes you feel like you're out there by yourself, and we all don't like to be in that we don't like that feeling, and not everybody's strong enough to stand there.
Well, that's a great point. Now, we'll take a short break. I'd like to invite you both to share some advice as caregivers, as parents, so that our viewers can hear from your heart what you think is important about dealing with this issue. You've done some of it already. We look forward to hearing some more from you after the break. We'll see you all after the break.
I don't know how we would have survived without Mediacom. We have 5 kids, my wife and I, and we have Mediacom for all of our internet and all of our cable services. So I'm stuck in my house, but at the same time, I'm connected to people all over the world, and it's been fantastic.
Thanks to Mediacom, I've had reliable internet to continue to work business as usual, that I can continue to provide for myself and my family.
Right now, we all feel like the world is in a standstill. The internet has played a huge role in allowing us to stay connected to our jobs and the kids' schooling online, and finding fun and creative ways to stay connected with the ones that we love. We couldn't do it without Mediacom.
Today in Surviving Bad, we're taking a moment to talk about children, alcohol, and the reasons we need to protect them. Let's listen to some advice from our guests, information that may make a difference in your life. Mark, starting with you, if you're a parent, you're part of Iowa. When our parents are watching this show, what would you want them to take away from this as to being a part of the solution?
Well, I guess I want to encourage you to not be afraid to talk to your kids about alcohol, and being a good example is really important. That you live a life that tells the same message of what you're telling them. That you don't abuse alcohol. That you don't encourage the behavior that you're trying to stop in them. And so that's kind of the culture. We're all social people. Don't be afraid to not be one who thinks that you need to have fun. Or to have fun, you have to have alcohol. It doesn't necessarily have to be that way. You can have fun without having alcohol involved and live your life in a way that honors God, and you can raise your children that way.
That's a great point. And Laurel?
Again, I would just echo, I think, talking with our kids about expectations, setting boundaries with kids. Kids want boundaries, even though they push back on them, but then they know how far they can go, right? They know what you expect of them. And so I think it's just really important to have these difficult conversations with our kids, not only about alcohol, but other drugs, social media, all kinds of things, because no one's a parent because they want their kid to turn out to have addiction or other problems, right? And so it's really about taking the time to sit down and talk with your kids and help them figure out what's important to them. And then really ask them, are my choices, are they protecting the things that are important to me, or are they putting them at risk? And if my choices are putting things at risk, then I can reevaluate what my choices are. But I think it's really important to sit down and listen to what our kids are saying, because their world is different than ours. And they're bombarded with all kinds of different messages and different mediums that we didn't have. And so having these difficult conversations is really important. And there's no wrong way to do it. If you're listening and gathering facts and data and research to share with them, then there's no right or wrong way to do it, but just do it.
Those are great points. And it's good to hear that there's a way that working together from the family up to the Capitol Hill, we can find ways to protect our children and give them a healthy world to grow up in. Thank you all for joining us today. You can go to our website at healthyiowa.org for more information. Keep your eye on Mediacom MC22 for our next episode of Surviving Bad, where we explore Iowa stories of survival, hope, and inspiration on Mediacom MC22, your local programming leader.